Our line of prestigious speakers are not ending yet. So now to deliver the USANZ lecture, Urology Society of Australia and New Zealand, we have the president herself, and she is none other than Professor Helen Connell. She is a consultant urological surgeon and currently the president. Over to you, madam.
Thank you so much, President Mandula, and congratulations on this wonderful meeting at this beautiful new venue. What a great landmark achievement for you to reach 25 years and enjoy your silver anniversary. I have no disclosures. So for the last few decades, we've been working on anatomy of the female pelvis, and this is the team of collaborators, including John Delancey from the University of Michigan, who gave us access to a database of MRIs. Gray's Anatomy says that the female urethra is completely unrelated to the clitoris, and our dissections and then MRI studies showed that was far from the case. And you can see in this, we've put purple plasticine over the shape of the clitoris. You can see it has a horseshoe relationship to the urethra, and Gray's is entirely wrong. This is the MRI studies, and you can see in white the shape of the clitoris with the urethra and vagina in the core, so it's a sort of pyramidal structure, and this is still very unfamiliar anatomy to many of our colleagues, but it's becoming very clear to people who provide female sexual medicine, which is an important and growing part of urology, that this anatomy is the epicentre of the female sexual response, as opposed to the conventional belief of what's important to a male sexual response. Cliteracy is a growing movement of awareness of this anatomy, and you can see from this art that was created by a television network the relationship between the bladder and other pelvic organs and the clitoris, which relates to the distal urethra and vagina. And on many of the tables, you'll see a 3D printed model, so you can actually understand the way this anatomy is. So they're from MRIs, these models that you've got on your tables, and unfortunately there's not enough for you to have one each, but you can pass it around so you can see what the status of this organ is in premenopausal women. But what was most of interest to the lay public and to journalists is what is going on with the G-spot. So this is a urethral anatomy belief popularised by Grafenberg and then by Whipple. And in all of our studies, we saw nothing to suggest there was a G-spot. Was it anatomical? Was it functional? Was it mythical? And so we did this study which demonstrated that we could not find any specific structure in the anterior vaginal wall or urethra consistent with cavernosal tissue. So we peeled back the anterior vaginal wall and there is nothing other than periurethral fascia. So was it actually a microscopic structure was the next study. And so with that first study, we looked at a series of 9 cadavers. We looked at we looked at microscopic tissue, but it was too degraded. We needed fresh tissue from shortly after death. But how could we get access to that? So there is a rapid autopsy program in Melbourne, but it's for cancer-only projects, except that the glands that transform and become adenocarcinoma in the urethral cancers are an important subset of urologic cancers about which we knew little, and so potentially we could investigate these glands via a rapid autopsy program and also understand the anatomy of the so-called G-spot. And so that is what we did, and so far we've studied 10 women who donated their bodies prior to death, and then we get this ultra-fresh histology to be able to answer these questions. We used large slices so you can have good reference range to the area of interest or the structure of interest at all times in relation to the whole urethra and anterior vaginal wall. We published this recently, demonstrating the anatomy of the glands of the female urethra and anterior vaginal wall. And so you see here the glands that are particularly large and circumferential around the lumen of the distal and mid-urethra. So these have various names but are clearly in the urethra. At the moment they're called female prostate or periurethral, but they're truly of the urethra. And then using QPath software, you can actually show the low power, which is on the right-hand side, and in the little red box, the high power gland, which has previously been anatomy that we didn't appreciate. But you can see that these glands identified in the proximal urethra do actually drain into the lumen in the same way as structures such as diverticular drain into the lumen. And so these glands appear to be the basis for diverticular pathology. And that has not been demonstrated before. And then at the meatal urethra, you can see how the clitoris inserts very close to the meatus. So this is the cavernosal tissue. You can see those glands. And so that's very useful to demonstrate that relationship in fresh tissue. In terms of prostatic markers, the oncology literature says that prostatic markers are only present in 50% of specimens. Of course, now we had access to this precious resource, the rapid autopsy program, and what it demonstrated is that prostatic markers, so-called, particularly PSAP, is present in all female urethral glands, which is clearly of importance for these oncologic studies. Tamelty, a group from the US, have looked at the impact of midurethral slings on these distal glands, which appear to have significance in terms of the lubrication response of women, and it looks like they are potentially traumatic to these glands. With respect to the Skene's glands, which are the same glands that we can see on the right-hand side here, this is a spot diagnosis, and it's quite a superficial pathology. I've seen at urology meetings how people will set up for this procedure in the same way as they would for a diverticulum, but it's very superficial pathology and a straightforward excision without any trauma to the urethra. So in summary, there is no macroscopic evidence of cavernosal tissue in the anterior vaginal wall except the clitoris itself, which is in the bulbs of the clitoris. We were serendipitously able to study glands responsible for adenocarcinoma, which are relevant to sexual health and benign disease such as cysts, diverticular and urethritis. Proximal glands draining into the urethra have not been described before, but we've demonstrated them clearly. And the mid to distal urethral glands have large ducts and are believed to be crucial for lubrication of the vulval vestibule and therefore the female sexual response. Prostatic markers are ubiquitous to female urethral glands, particularly PSAP. There's been a lack of expression previously in the literature, which is presumably related to a lack of access to rapid autopsy material. And in female urethral carcinoma, the pathologist should use PSAP primarily rather than PSA for its ubiquitous expression. You can see on that slide with the meatal urethra where the cavernosal tissue inserts laterally, and midurethral glands are believed to be at risk in midurethral surgery. And then you have to question, is the term female prostate useful when we're talking about female urethral glands? Thank you for your attention this morning about a topic that is increasingly important to women and therefore to us as urologists. Thank you.
Thank you, Helen. So we got the information from the World Authority on the Clitoris. I was thinking she will talk only about the urethra, but she of course touched on her favorite area. Right. So now we would like to present a token of appreciation from the association. Madam, if you could make yourself to the center of the stage, please.